Hi guys, welcome back to CanBaby Surrogacy. I'm Ethan, a senior embryologist living and working in North America. Here we focus on affordable surrogacy and help people make smart, realistic choices based on science, not fantasy. Today I want to talk about something a lot of people don't really think about, but it can become a very serious problem. What happens if you get pregnant with triplet after IVF? At my clinic, I often meet patients who say, Ethan, we want twins, or even triplet. And when they say that, their eyes usually light up. Some of them smile nervously, some speak very firmly. For many couples who have struggled with infertility for years, the idea of getting more than one baby at once sounds like the ultimate happy ending. In their minds, twins or triplets mean saving time, saving money, and finally getting to hold multiple babies in their arms at the same time. I understand where they are coming from. Many of them have tried for years. They've gone through countless hormone injections, blood draws, egg retrievals, transfers, miscarriages, disappointments. When they finally have a chance to do IVF again, they want to make the most out of this one big chance. Let me share a real case with you. Back in 2019, before COVID, I worked with a couple. The woman had a lower chance of success. So after carefully discussing, we decided to transfer 2 embryos. Normally, if one of those 2 embryo implants, we'd already consider it a good outcome. For patients with weaker ovarian reserve or lower probability of implantation, even one healthy pregnancy is considered a win. But to everyone's surprise, both embryos implanted and one of them split into 2 babies. So instead of 1 or 2, she was pregnant with triplet. Of course, the couple was over the moon. They were so happy. After so many years of trying, this felt like a miracle. I remembered the day we told them about the result. They laughed, they cried, they hugged. It was a powerful moment. I could feel how deeply they wanted this. But reality isn't always that kind. IVF can bring miracles, but it can also bring serious medical complications if patients don't fully understand what they are getting into. In the USA and Canada, most fertility clinics strongly recommend transferring only 1 embryo. And that's because the human uterus is designed for 1 baby at a time. The more babies you carry, the higher the risks. Multiple pregnancies increase the risk for both the mother and the babies, especially preterm births. Triplets are not just one more baby compared to twins. The medical risk curve doesn't rise in a straight line. It explodes exponentially. Preterm labor, low birth weight, respiratory problems, ICU stays, and maternal complications like preeclampsia, bleeding, or even life-threatening conditions all become much more likely. Some clinics, depending on their patient's age and health, may allow 2 embryos and accept a twin pregnancy. But triplets, that's a whole different story. Almost all clinics in North America will require the patient to sign a consent form and come back for fetal reduction surgery, usually to reduce triplet down to twins. Why? Because that gives the best chance for healthy delivery. It's not because doctors want to take something away from you. It's because they want you to have the best chance of holding a healthy baby in your arms at the end of this journey. So when we found out she was carrying triplets, we immediately contacted her to schedule the procedure. But she disappeared. No response to our calls, no show for the appointment. I understood her. After years of wanting a baby, suddenly being told to reduce one, it's an emotional, painful decision. To her, it felt like being forced to give up a child she had finally, miraculously. I understand that feeling, and as medical professionals, we have to approach it with empathy. But biology doesn't care how we feel. Carrying triplets puts extreme pressure on the uterus. It's not just emotionally heavy, it's medically dangerous. In the end, she went into very early preterm labor. All 3 babies were lost. When she came back to the clinic for follow-up, she was heartbroken. She told me she regretted not listening to her advice. It was one of the hardest conversations I've ever had with a patient. I still remember the look in her eyes, tired, empty, full of regret. This is why these conversations need to happen early. And honestly, because once you are in the middle of a triplet pregnancy, your choices are already limited and time is ticking. Multiple pregnancy is not a bonus, it's one of the main complications of IVF, along with ovarian hyperstimulation syndrome. Twin pregnancy has higher risk, but sometimes it's acceptable when managed carefully. Triplet pregnancy is almost never safe. Some clinics will strongly recommend reducing from 3 to 2. This is not because your doctor doesn't care. It's because your doctor wants to protect you and give your baby the best chance to live. If the uterus is too stretched, if the baby are born too early, you can end up losing everything. And that's something no one wants. So if you are doing IVF or surrogacy, whether in the USA or Canada or overseas, please always listen to your fertility specialist. Their goal isn't to take away your dream. Their goal is to help you bring home a healthy baby. IVF is powerful, but it's not magic. It has real limits, and those limits exist to protect you. That's all for today's video. If this helped you, please like, subscribe, and share. I'm Ethan from CanBaby Surrogacy, your source for real talk about IVF and affordable surrogacy. See you next time. Take care.